So hello students, very good morning to everyone. And today I am going to start new chapter, that is 2.4, and the name of that chapter is cardiovascular drugs. Cardiovascular drugs. So before the starting of this cardiovascular drugs, we'll revise that what we had learned in the last lecture. So in the last lecture, we had learned the synthesis of cetirizine. So the synthesis of this cetirizine start with 4-chlorobenzyl chloride in presence of N-carbethoxy piperazine. In presence of Na2CO3, you will get this product. Then the next step is simply the hydrolysis of this ester in presence of HCl. So the hydrolysis followed by decarboxylation, you will get this product. Then this product undergoes condensation reaction with this halide, and so this bicarbonate, sodium carbonate, it acts as a base. You will get this product. Then the next step is the hydrolysis of this ester in presence of KOH and HCl. You will get this final product, and the name of this final product is cetirizine. So this is your cetirizine. So student, I'm actually starting our new chapter, that is cardiovascular drugs. So the heart and blood vessel constitute the cardiovascular system. The function of heart is to pump blood, whereas the blood vessel, that is arteries and veins, distribute that blood to different parts of the body. So the heart and blood vessel constitute the cardiovascular system. Heart and blood vessel constitute the cardiovascular system, and the function of this heart is to pump the blood, whereas the blood vessel, that is arteries and vein, constitute of your blood vessel, distribute this blood to various different parts of the body. So the cardiovascular, these are the agents, or these are the drugs which acts directly or indirectly on heart and blood vessels, so as to improve the output of heart and the distribution of the blood to the different parts of the circulating system. So the cardiovascular drugs are defined as, these are the drugs which require to rectify any abnormality in the physiology and the functioning of the heart and blood vessel. That drug is called as cardiovascular drugs. So cardiovascular agents are the drugs which act directly or indirectly on heart and blood vessels, so as to improve the output of the heart and the distribution of blood to different parts of the circulating system. So this definition of cardiovascular drug is that these are the drugs which require to rectify any abnormality in the physiology and functioning of the heart and the blood vessel. That drug is called as cardiovascular drug. So the drug that used to rectify any abnormality in the physiology and functioning of the heart and the blood vessel, called as cardiovascular drugs. So this is your cardiovascular system. Cardiovascular system consists of heart and blood vessel. Blood vessel means that it contains arteries and your veins. So the function of this heart is to pump the blood to various parts of the body through the veins and arteries. The next point is, we'll see the classification of cardiovascular drugs based on its physiological function. The classification of cardiovascular drugs based on its physiological function. So the first class is your cardiotonic drugs. Cardiotonic drugs. So this cardiotonic drug, these are the steroidal glycoside. So these are the drugs. These cardiotonic drugs, these are the steroidal glycosides which occur in a plant known as Digitalis purpura. So these cardiotonic drugs obtained from the plant, and the name of that plant is Digitalis purpura and Digitalis lonata. So digitoxin and digoxin are well known cardiac glycosides. So these are the two, digitoxin and digoxin. These are the two well-known glycosides, cardiac glycosides. These are the choice drugs in the treatment of congestive heart failure. So this drug digitoxin used in the treatment of congestive heart failure and the digitalis tend to increase the contractility of heart muscle. The role of this digitalis is increases the contractility of heart muscle and it increases the force and velocity in the contraction phase of cardiac cycle, and thus it helps to complete the emptying of ventricles. And due to these properties it is used in spite of side effect, that is it has a side effect, that is a toxicity and a low therapeutic index, because that is important. It tend to increase the contractility of heart muscle and it increases the force and velocity in the contraction phase of cardiac cycle and thus helps in complete emptying of the ventricles. And due to these properties, this drug is used in the treatment of congestive heart failure. And the example of that cardiotonic drug is digitoxin tablet. So digitoxin used as a cardiotonic drug. So cardiotonic, these are the steroidal glycosides occur in a plant and the name of that plant is Digitalis purpura and Digitalis lonata. So digitoxin and digoxin, these are the two well-known cardiac glycosides and these drugs are used in congestive heart failure. And the role of this digitalis, it increases the contractility of heart muscle. It increases the contractility of heart muscle and it increases the force and velocity in contraction phase of cardiac cycle and thus it helps to emptying of the ventricles, and due to this property it is used as a cardiotonic drug and the example is digoxin. So this is all about the first class cardiotonic drugs. Next one is we'll see second one, that is vasodilator. So this vasodilator, so these are the drugs, these are the group of drugs which primarily act on vascular system. So these are the group of drugs vasodilators. So vasodilator, these are the group of drugs which primarily act on vascular system. The coronary artery, the role of coronary artery is to supply blood to heart muscle. When the heart is overworked, more CO2 is produced and due to metabolism in heart muscle causing greater demand of O2. Due to the narrowing of coronary artery, the O2 supply become insufficient and this puts further strain on heart and which result in severe pain which is called as angina. So the role of coronary artery is that it supply blood to heart muscle, and when the heart is overworked, more CO2 is produced and due to the metabolism in heart muscle it causes greater demand of O2. And due to the narrowing of coronary artery, the O2 supply become insufficient. Due to narrowing of coronary artery, the O2 supply become insufficient. O2 supply become insufficient, and this puts further strain on heart, which result in severe pain, which is called as angina pectoris. So the therapeutic action of vasodilator is due to their ability to dilate the coronary blood vessel by relaxing the smooth muscle. So this increases the coronary blood flow which increase the oxygen supply to heart muscle. Therefore, the vasodilator and anti-anginal agent is used to treat the coronary artery diseases, especially especially angina pectoris, and it relieves the pain associated with that. This drug should be fast acting and should last for prolonged period, and however they should not produce or should not develop the tolerance. So this vasodilator, it has a high therapeutic action, and the high therapeutic action of this vasodilator is due to their ability to dilate the coronary blood vessel by relaxing the smooth muscles. The increasing coronary blood flow increases the oxygen supply to the heart muscle. Therefore, vasodilator or anti-anginal agent is used to treat coronary artery diseases, especially angina pectoris. That's why it is called as anti-anginal, and relieve the pain associated with that angina pectoris. So these drugs should be fast acting drugs and should last for prolonged period. Now, however, this drug should not develop the tolerance, and the example is benazepril, benazepril and captopril. These are the two example of vasodilator. This is the image of that benazepril, captopril. So this is about vasodilator. So the vasodilator, these are the groups of drugs which act primarily on vascular system, and the role of coronary artery is that it supplies blood to heart muscle. When the heart is overworked, more CO2 is produced, and due to the metabolism in heart muscle, it causing greater demand of O2. Due to the narrowing of coronary artery, the O2 supply become insufficient, and this puts further strain on heart, which result in severe pain, which is called as angina. And the therapeutic action of this vasodilator is due to their strong ability to dilate the coronary blood vessel by relaxing smooth muscle, and this increases the blood flow, which increases the oxygen supply to the heart muscle, and therefore vasodilator or anti-anginal agent is used to treat coronary diseases, especially angina pectoris and the pain associated with that. And it should be fast acting and should not develop the tolerance. An example is benazepril and captopril. This is the image of that. Then next class is your antihypertensive drug. Antihypertensive drug. So the blood pressure is due to the pumping of blood by the heart through the blood vessel. So the blood pressure is due to the pumping of blood by the heart through the blood vessel. The arterial blood pressure depend on cardiac output, total blood volume, viscosity of blood, elasticity of arteries, and the peripheral vascular system, and blood flow, and the resistance to blood flow. So the arterial blood pressure is depend on cardiac output, total blood volume, viscosity of blood, elasticity of arterial and peripheral vascular resistance to blood flow. So there are two phases of cardiac cycle. There are two phases of cardiac cycles are there. That is diastolic, that is called as relaxation phase, and systolic, that is called as contraction phase. Diastolic and systolic. Relaxation and contraction phase. The resting of blood pressure for diastolic is 90 mm, and for systolic it is 140 mm. This considered as a standard, this considered as a normal blood pressure. And the hypertension is the condition in which the systolic pressure exceeds to 90 mm. If the systolic pressure is exceeded from 90 mm and systolic pressure exceed to 140 mm, which manifests in symptoms such as tiredness and dizziness and headache. that is called as hypertension. In hypertension, what happens? The diastolic pressure increases from 90 to more than 90, and systolic pressure increases from 140, which is the normal blood pressure, and that this manifests the symptoms such as tiredness, dizziness, headache. So the hypertension is due to kidney disease and release of hormone, that is renin, which constrict the arterioles and deposit the cholesterol, which thickens the artery, and all of this offer the resistance to blood flow and increase the blood pressure. So this factor responsible for the hypertension, that is the hypertension is due to kidney failure. Kidney failure increases the hypertension. Then release of hormone, that is renin, and which the role of this renin is which it constricts the arterioles and deposit the cholesterol, which thickens the arteries. So this cholesterol thickens the arteries, and this all these factors are resist to this shows the resistance to blood flow and thus increases the blood pressure. So the hypertensive or hypotensive, the definition of hypertensive or hypotensive drug is that these are the drugs which counter react hypertension by reducing the blood pressure to normal level and thus removing the associated pain and symptoms. That drug is called as hypertensive or hypotensive drugs, and the symptoms are tiredness, dizziness, and headache. So hypertensive and hypotensive drugs, these are the drugs which counter react hypertension by reducing the blood pressure to normal level and thus remove the associated pain and discomfort. That drug is called as hypotensive or hypertensive drug. Example is this Cardimap. So this uh, so the blood pressure is due to the pumping of blood by heart through the blood vessel. So the arterial blood pressure depend on cardiac output, total blood volume, viscosity of blood, elasticity of arteries, and peripheral vascular resistance of flow of blood. So these are the factors which is responsible for increasing the arterial blood pressure, and it depend on this factor, that is cardiac output, total blood volume, viscosity of blood, and elasticity of arteries, and peripheral vascular resistance to blood flow. So there are two phases of cardiac cycle are there. Two phases of cardiac cycles are there. That is diastolic 90 mm, systolic 140 mm. So diastolic means the relaxation phase, and systolic means contraction phase. So where the relaxation of heart and contraction of heart. So uh, diastolic is 90 mm, and systolic is 140 mm. The resting blood pressure 90 mm for diastolic and 140 mm for systolic, and this is considered as a normal blood pressure. This is considered as a normal blood pressure 90 and 140. So so the hypertension is the condition in which the diastolic pressure exceeded above to 90 mm and systolic pressure exceeded 140 mm above to 140 mm, which manifest in symptoms such as tiredness, dizziness, and headache. So hypertension is due to kidney failure and renin hormone. And the role of this renin hormone is which constrict the arterioles and deposition of cholesterol, which thickens the arteries, and all this factor resist to flow of blood and increases the blood pressure. And the drug which counter react hypertension by reducing the blood pressure to normal level, that is 90 and 140. thus by removing associated pain and associated symptom and discomfort. That drug is called as hypertensive or anti or hypertensive or hypotensive drug. So this is all about that. And next one is your anti-hypercholesterolemic drug. Anti-hypercholesterolemic drug. So, the cholesterol, it is a steroidal alcohol present in higher animals and human beings. So cholesterol, it is a steroidal alcohol present in all higher animals and human beings. The normal serum cholesterol level is 170 to 200 milligram mg%, in which 30% is present in a free state and 70% present in a ester state. The fats are precursor of cholesterol. Increase in the consumption of saturated fats increases the cholesterol level. Increase in the consumption of saturated fats, it increases the cholesterol level. This result in deposition of fat and cholesterol on the inner lining of arteries. So this result in deposition of fat and cholesterol on inner lining of arteries. This leads to atherosclerosis, which thickens, which is thickening and hardening of arteries. That is called as atherosclerosis. Means that thickening and thickening and hardening of arteries, atherosclerosis. Therefore, there is a narrowing of channel of artery, hence the blood flow is restricted and thus increases the blood pressure, which result in the cardiac disease. So this is the main reason, that is cholesterol. So this cholesterol is a steroidal alcohol present in higher animals and human beings. The normal serum cholesterol level is 170 to 200 mg%, in which 30% is present in a free state, while 70% present in a ester state. The fats are the precursor of cholesterol. Fats are the precursor, or the fats are the main reason for the cholesterol level, to increase the cholesterol level. And increasing the consumption of saturated fatty acid, saturated fats increases the cholesterol level. If you increase the consumption of saturated fats, it increases the cholesterol level. And this increasing cholesterol level, this result in the deposition of fat and cholesterol on the inner linings of arteries, and this leads to the thickening and hardening of the arteries. Therefore, there is a narrowing of channel of artery, hence the blood flow is restricted. Due to narrowing of an artery, the blood flow is restricted, thus increase the blood pressure, which result in the other cardiac disease. So anti-hypercholesterolemic, these are the drugs or the compound which used to reduce the serum cholesterol level and thus prevent the thickening and hardening and associated disease, that is called as anti-hypercholesteremic drugs. So these are the drugs, or these are the compounds which used to reduce the serum cholesterol level and thus prevent atherosclerosis and associated pain. That drug is called as your anti-hypercholesteremic drug. And the example of that anti-hypercholesteremic drug is aluminum niconate and D-thyroxine sodium and rosuvastatin. So these are the example of anti-hypercholesteremic drugs. So the person having higher cholesterol level in body, so that person is using this, doctor is prescribing this drug, and that person is using this drug, that is rosuvastatin and aluminum nicotinate and D-thyroxine sodium. So anti-hypercholesteremic, these are the drugs which used to reduce serum cholesterol level and thus prevent the atherosclerosis, which is atherosclerosis means thickening and hardening of arteries and associated pain. That drug is called as anti-hypercholesteremic drug, and it is a steroidal alcohol. Cholesterol is steroidal alcohol. Normal serum cholesterol level is 170 to 200 mg. Fats are the precursor of cholesterol, and if you are uh, if you going to increase the consumption of saturated fats, it increases the cholesterol level, that leads to atherosclerosis. So so this both cholesterol and fat deposit in inner lining of your arteries, and which lead to atherosclerosis, and which increases which restrict the blood flow and increases the blood pressure, and this result in various cardiac disease. And this rosuvastatin, aluminum nicotinate, and the D-thyroxine sodium. These drugs used for the uh, for this treatment of this atherosclerosis, and it reduces the cholesterol level to normal, that is in the range of 170 to 200 mg. So this is all about the anti-hypercholesterolemic drugs. Then the next slide, the next drug is next group of drug is sclerosing agent. So this sclerosing agent, the varicose veins are the disease vein. Varicose vein are the disease vein which are permanently dilated and hence unable to push back the impure blood to heart. So the varicose vein, these are the disease vein, and which are permanently dilated and hence unable to push back the impure blood to heart. They are permanently dilated, and the sclerosing agent irritate the internal layer of the vein. The role of this sclerosing agent is it used to irritate the internal layer of vein, which causes adhesion of endothelium and vein is closed. So the role of this sclerosing agent is it used to irritate the internal layer of vein, which causes adhesion of endothelium and the vein is closed. So they are used for the obliteration of varicose vein. So the role of this sclerosing agent is they are used to obliterate the varicose vein, and the example of these sclerosing agents are sodium salicylate, glucose saline, then monoethanolamine, oleate. So these are the example of sclerosing agent, and the sclerosing role of this sclerosing agent is used to irritate the inner layer of vein, and it used for the obliteration of voracious vein. And voracious vein means that these are the disease vein which are permanently dilated, and hence they are unable to push back the impure blood to heart. So this sclerosing agent, that is sodium salicylate and your glucose saline, is used to irritate the internal layer of vein, and it used for the obliteration of voracious vein or varicose vein. So this is all about sclerosing agent, and the example of sclerosing agent is sodium salicylate, then glucose saline, monoethanolamine, oleate. Then the next class of drug is antiarrhythmic drug. Antiarrhythmic drug. Antiarrhythmic drug. So, normally what happen? Normally the heartbeat occur at a particular rate and rhythm. So normally the heartbeat occur at a particular rate and particular rhythm in a normal person, in a fit person. However, due to some disease and the use of certain drugs, however, due to some disease and use of certain drugs, the heart rate may increases and the rhythm may be disturbed. So due to use of drugs and due to certain disease, the heartbeat rate may increase and the rhythm may disturb. The irregular heartbeat is called as arterial fibrillation. The irregular heartbeat is called as arterial fibrillation with very high heartbeat rate, that is 180 beat per minute. There may be vascular collapse or pulmonary congestion. So due to the disturbed rhythm, so it causes vascular collapse or pulmonary congestion, heartbeat more than 180 per minute. So this may result in vascular collapse and pulmonary congestion. So this antiarrhythmic, these are the drugs. The antiarrhythmic, these are the agents. The antiarrhythmic agents are the drugs which use to modify the cardiac rate. Used to modify the cardiac rate and restore them to restore the rhythm and restore the rhythm rhythm. That drug is called as antiarrhythmic drug. So antiarrhythmic agents are the drugs which are used to modify the cardiac rate and restore the rhythm to normal level. That drug is called as quinidine. That drug is called as antiarrhythmic drug, and the example is quinidine. So you know that in the normally in the healthy person, the heartbeat occur at a particular rate and particular rhythm. However, due to the use of some drugs and some due to some disease, the heartbeat rate may changes and the rhythm may disturb. The irregular heartbeat is called as arterial fibrillation. So with very high heartbeat rate more than 180 per minute. So due to this, there may be vascular collapse or a pulmonary congestion, which is very dangerous. So the drugs which use to modify the cardiac rate to normal and restore the rhythm, that drug is called as antiarrhythmic drugs, and the example is quinidine. Then the next one is your diuretics. So the role of the role of kidney is it is the role of kidney is it is a excretory organ which plays an important role in regulating the volume and composition of body fluids. So the kidney, it is an excretory organ and which plays important role in regulating the volume and composition of body fluid. The functional unit of kidney are known as nephron. The functional unit of kidney is known as nephron, and it consists of three parts. Each nephron consists of three parts, that is the renal capsule, renal tubule, and renal collecting. So the role of this nephron is the nephron filters passively water electrolytes, like it it filters the water and electrolytes like sodium, potassium, ammonium, calcium, magnesium plus sodium ion, potassium ion, ammonium ion, calcium ion, magnesium ion, chlorine ion, then HPO4 minus ion, H3O plus ion. So these are the electrolytes, and the non-electrolytes like urea, uric acid, creatinine, and glucose through the Bowman capsule, which covers the renal capsule, which covers the renal corpuscle into renal tubule. The plasma protein are not filtered due to due to their large size, On an average, kidney tubules filter about 150 liters of liquid, out of which 90% filtrate is reabsorbed and 1% is excreted as a urine, which contain urea, uric acid, and some electrolytes. So, so you know that the kidney is the excretory organ and which plays important role in regulating the volume and composition of body fluids. The function of kidney has a functional unit and that is called as nephron, and the each nephron consists of three parts, that is renal capsule, it's a renal corpuscle, not the capsule, it's a renal corpuscle, the renal corpuscle, renal corpuscle, renal corpuscle, renal tubule. So, the functional unit of kidneys, your nephron, and each nephron consists of three parts, that is the renal corpuscle, then renal tubule, and renal collecting. So the nephron filters. The role of this nephron is it positively filters water and electrolyte like sodium, potassium, ammonium ion, calcium, magnesium, chlorine, HPO4, H3O plus, and the non-electrolytes like urea, uric acid, creatinine, glucose through the Bowman capsule, which covers the renal capsule into the renal tubule, and the plasma protein are not filtered by kidney due to their large size. On an average, kidney tubules filter about 150 liters of liquid, and out of which 99 filtrate is reabsorbed and 1% is excreted as a urine, which contain urea, uric acid, and some electrolytes. So diuretics, these are the drugs which used to increase the output of the kidney. So diuretics are defined as these are the drugs which used to increase the output of kidney, thereby reducing the extracellular fluid in the body. Diuretics indirectly act on the cardiovascular system by regulating the body fluids and their composition, and it prevents the edema. So diuretics, these are the drugs which used to increase the output of kidney and thereby reducing the extracellular fluid in the body. And diuretics, it indirectly act on the cardiovascular system by regulating the body fluid and their composition, and it prevent the edema. So the osmotic diuretics are low molecular weight compound. Osmotic diuretics, these are the low molecular weight compounds which form hypertonic solution and cause water to pass from blood to tubule and producing diuretic effect. For example, mannitol and urea. So this mannitol and urea, example of diuretics, and the role of this diuretic is mannitol and urea is that the, these are the osmotic diuretics, and these are low molecular weight compounds. Mannitol and urea, these are the low molecular weight compounds which form hypertonic solution and cause water to pass from blood to tubule, and thus that is producing diuretic effect. Example is your mannitol and urea. So this is all about your diuretics. So diuretics, so you know that the kidney is most important. The role of kidney is it is act as a excretory organ. So it's here not a regulatory. Yeah, kidney is the excretory organ. Kidney is the excretory organ.
You can feel your heart thudding away every time you put your hand to your chest. But do you have any idea what's really going on in there, or what keeps your heart ticking as it should? Every day, your heart beats about 100,000 times, sending 2,000 gallons of blood surging through your body. Although it's no bigger than your fist, your heart has the mighty job of keeping the blood flowing through 60,000 miles of blood vessels that feed your organs and tissues. Food, water and oxygen are essential for the existence of human life. Blood transports all these substances through various channels called blood vessels. Blood vessels involves arteries, veins, capillaries. To keep the blood flowing throughout our body, we have a pumping system, and the heart is the pump, which is composed of muscle that pumps blood throughout the body, beating approximately 72 times per minute of our lives. The human heart has 4 chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. There are 4 valves in the heart. These valves are tricuspid valve, mitral valve, aortic valve, pulmonic valve. These valves are one-way valves. Now, you have seen the structure of the heart. Let us find out how it works. The blood becomes oxygen-rich by absorbing oxygen in the lungs. The function of the heart starts when oxygenated blood is carried from the lungs to the left atrium of the heart by means of the pulmonary veins. The left atrium relaxes, this blood is pumped into the heart. When the left atrium contracts, the left ventricle relaxes simultaneously. The left atrium pushes the blood into the left ventricle through the one-way valve. When the left ventricle contracts, the blood is pumped into the aorta, which carries oxygenated blood to the different parts of the body, except the lungs. Oxygenated blood reaches the different parts of the body through the blood vessels called the arteries. The arteries gets branched into capillaries, which then reaches to the different organs of the body. The blood then becomes deoxygenated, and the blood capillaries gets mixed and form thicker blood vessels called the veins. The veins carry deoxygenated blood to the heart. The blood vessels that carry deoxygenated blood to heart are known as the vena cava. The deoxygenated blood from different parts of body enters the upper right chamber of the heart, which is called the right atrium. The right atrium gets contracted, allowing the blood to flow into the right ventricle, which contracts with the expansion of the right atrium through the one-way valve. The right ventricle then contracts, pushing the blood into the pulmonary artery. The pulmonary artery carries the deoxygenated blood to the lungs for oxygenation. The lungs oxygenate the blood by exchanging of gases and flows back into the heart through the pulmonary vein, and starts the circulatory cycle all over again.